Restless leg syndrome is generally known as a condition where people have discomfort in their legs and an urge to move. But can it be painful? I'm Dr. Andy Burkowski of ReLACS Health, and today's topic is the painful variant or variants of restless leg syndrome. So, as a summary, restless leg syndrome is a neurologic condition occurring mostly in the brain where individuals develop an irresistible urge to move. That urge to move is relieved by movement, and it should generally occur at nighttime and get worse with not moving or resting, lying down. But many individuals, perhaps 5, 10% of those with restless leg syndrome, can actually experience pain that could be described almost like a burning or any other type of pain that is somewhat describable. These individuals are often misdiagnosed with other nerve or pain conditions and may actually have restless legs syndrome because they have most of the hallmark features of restless legs, but it's unusual to have this pain symptom actually be described as painful when it's usually this indescribable discomfort. But research has shown that there is a subset of individuals with this painful variation of restless leg syndrome. What has been shown to be the differences between this and what we would call classic restless leg syndrome? Well, some of the research has been done by Dr. Elias Karoum at George Washington University over the years. And in 2023, he even had another abstract on this topic. But there are a couple general differences. One is that those with painful restless legs syndrome tend to have slightly higher iron levels in their body, not necessarily in their brain, but in their body, and may not respond as well to iron supplementation or iron infusion. So that's one possible difference. A second one is a lot of the classic treatments for restless legs don't work quite as well as medications like opioids. Opioids, again, being what we call narcotic pain medications that relieve are very effective for all forms of restless leg syndrome, but sometimes work even better in those with painful restless leg syndrome. And why might that be? Well, there's been recent work out of Dr. Brian Koo of Yale, who has studied the chemical opioid system of the brain in individuals who are without restless legs, who have quote unquote classic restless legs, non painful restless legs, and those with painful restless leg syndrome. And he shows that there's dysfunction of the opioid system. We call it the system the melanocortin system, which has nothing to do with melatonin, by the way, or melanin, but the melanocortin system. There are defects in individuals with restless leg syndrome. So one is that those with restless legs have low beta endorphin levels, and this is kind of a chemical in the brain that helps to relieve pain and to decrease movement. So if you're low on a chemical that reduces pain and movement, there you go, painful restless leg syndrome, more pain, more movement. And then the opposite is that those with restless legs may have high levels of melanocyte stimulating hormone, particularly those with painful restless legs. And guess what? That hormone, if sends to when you do studies in mice, the mice move around a lot more and are more sensitive to pain. So that kind of fits with what we're seeing in terms of the clinical presentation, like what doctors actually see in clinic. Some of the biology is now backing that up. So, what should be done for those with painful restless leg syndrome? Well, it's really you start with all the usual stuff good sleep hygiene, good lifestyle habits, avoiding treatments, medications, substances that trigger restless legs. So, that goes without saying. Second thing is to avoid dopamine agonists. People on dopamine agonists develop augmentation. It may be inevitable. That's why the 2024 American Academy of Sleep Medicine's clinical practice guidelines do not recommend any of the dopaminergic drugs as a standard treatment for restless leg syndrome anymore. And one of the things that I've personally seen is those who develop augmentation from dopamine agonists can develop the painful form of restless leg syndrome as their condition becomes worse. So I've had individuals who have had classic discomfort restless leg syndrome, non painful, and then after augmentation, they actually start to develop pain. And that's kind of a frightening thing for those with restless leg syndrome. So avoid dopamine agonists. And then the usual treatments, the alpha 2 delta ligand treatments like gabapentin and pregabalin. But then there must be a strong consideration for opioid therapy in people with moderate to severe restless leg syndrome, particularly painful restless leg syndrome, because maybe in some sense, with these issues of the deficiencies in the opioid system, giving a low dose opioid can sort of supplement what's deficient in the brain. And that could be why these drugs are so effective for the painful variant of restless leg syndrome. But the most important thing is getting the diagnosis correct, distinguishing painful restless leg syndrome from other conditions like nerve damage or some sort of other type of muscle or nerve pain condition. And that's really getting back to those classic features of the condition being relieved by movement, worse at night, and worsened with rest. And that's really important, is to make sure the condition is identified so that it can be treated effectively, because not all treatments for pain are good for restless legs syndrome. As always, this video is for general information only. It does not constitute medical practice or the giving of medical advice. So please make all decisions about painful restless leg syndrome and its treatment under the care of a licensed medical professional. And as always, one of the keys to sleeping well is to relax.